Hi, I'm Dr. Nichelle Haynes.
I'm Dr. Kristin Lasseter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
And breastfeeding. So today we are going to be talking about escitalopram and breastfeeding and if they are compatible. First things first, always the caveat, we are not your doctors. We cannot, give you official recommendations on these things. We're just going to talk about the data and some things that we would typically recommend to our patients if they're considering utilizing escitalopram while they are breastfeeding, or if they're pregnant and they desire to breastfeed. These are the conversations that we would usually have.
Right. With escitalopram, or Lexapro is the brand name in the United States, it is a medication that overall is considered what we call compatible with breastfeeding. So what we mean by that is that it's not secreted in large amounts in the breast milk, and it's not expected to have any adverse effects on the infants. Of course, everything is case by case.
Mm-hmm. Right. So just for some context, when we talk about a medication being compatible with breastfeeding, as long as there isn't some glaring thing, any baby who gets any small amount turns green, or like whatever the thing happens to be, right? And as long as there's nothing like that, we consider the amount that's excreted in the breast milk, anything less than 10%, to be generally safe, as long as we don't have any additional information.
The relative infant dose to be less than 10%.
Right, trying not to explain. So sorry.
That's okay.
So basically that would be the dose that the infant gets relative to the amount that the mom gets.
As long as that's less than 10%, in general, it's considered compatible with breastfeeding.
Such a bad job explaining that.
No, you did great.
Okay. So that, with that context, the relative infant dose for escitalopram that we are aware of right now is anywhere in the studies between 1.7% and 7.7%. So for babies who are generally healthy and term and meeting their milestones, we consider this medication to be compatible with breastfeeding. And we would also say to our patients that it's okay if you would not like to breastfeed for whatever reason, but taking escitalopram while you are breastfeeding is not necessarily a reason to stop.
Correct.
Is that how you would say it?
Yeah.
Okay.
And the research that we have looking at infants who have breastfed while their mothers were taking escitalopram show that the vast majority don't have any kind of adverse effects. And in general, that's kind of been the case, I think, that we've seen with our own patients. But there are case reports out there of like random individual side effects that some babies might experience. So I always tell my patients to talk with their pediatrician, let their pediatrician know that they're taking this, so that you can kind of just keep an eye out or keep that in the back of your mind in case anything goes on with your baby.
So overall, we would say generally, yes, but of course, talk to your doctor, talk to your child's doctor, and make a decision that's right for you. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.